Can you change and prevent premature ovarian ovulation? Can it be done by using an antagonist? And this paper does answer it. So it's a retrospective study. It looks at investigating the effectiveness of administering a single dose of antagonist after HCG to prevent premature ovulation, especially in women who have undergoing IVF with a diminished reserve. It includes 267 women aged 25 to 35 with a single antral follicle, divided into case group 102 patients receiving antagonist after HCG and a control group following the standard treatment. And what they want to see is what was the impact of premature ovulation, with a secondary goal of looking at pregnancy rates. And that was in Gynecological Obstetrics, where it was published. So if you look at the results, in where the antagonist was administered, the premature ovulation rate was 6.86% compared to 20% in the control group. Oocyte retrieval rate was 93.14%, while it was 67.87% in the control group. Mature oocytes was 79.42 compared to 47.87 in the control group. And fertilized oocyte rate was 65.68% in the control group. Embryo transfer rates were better, looking at 44.11 in the case, 78 in the control group. Clinical pregnancy rates once the embryos was transferred were no different. So what did this study conclude? It concluded that if you administer the antagonist after HCG triggering, it significantly reduced premature ovulation in patients with diminished reserves. More embryos to transfer, more number of oocytes, and no impact on pregnancy rates as long as embryos were transferred. Where do we find it beneficial? Especially if you're going to do a modified natural cycle where you're going to get one or two oocytes. It probably administer an antagonist after HCG. There are limitations because it was a small sample size. So if you look at it from what you consider from a clinical practice, I would say, well, it's one of the studies which says that after the HCG, giving an antagonist may prevent premature ovulation. That's something which we in fact haven't heard of before and has not been used so often. And that's more likely to get you to an egg collection and give you a better oocyte outcomes. The strengths were it was very much a focused group, clear comparison, and multiple outcome measures were measured. What was the limitations? Retrospective design, small sample size, age range was younger women, maybe different with older women, single center study, and long-term outcomes. It did not look at the long-term outcomes at the side effects. So in effect, I would say that this was a short paper doing something different, doing an antagonist after the HCG trigger on a day after the HCG trigger. So I think it's something worth looking at and maybe giving it a try. It probably causes no harm certainly, but it may very well give us the chance of getting to an egg collection.